Okay, thank you so much for joining me today. I'm here with Secretary Jerome Lockridge, Patty Davis, who's the president of the Oklahoma Hospital Association, and then we have Dr. Mo Som from OSU Medicine, and I also have Lieutenant Colonel Yolanda Murray from the Oklahoma National Guard with me today to give us an update. But we're here to talk about our comprehensive hospital surge that we've been putting together over the last month. It's designed to make sure Oklahoma is fully prepared to handle any surge in our hospitals and to our healthcare system. Before I get into the specifics, I wanted to share a few updates. As this is Easter weekend, I want to remind Oklahomans that my Safer at Home order applies to any groups of 10 or more. Churches are doing an excellent job of innovating, and I will be watching church online on Easter Sunday with my family in our living room. I know these are very difficult times for people who have lost loved ones, and my heart breaks for anyone who's having to deal with this tragedy at this time. But it is imperative that we limit gatherings to 10 or more. Many funeral homes have been offering ways so many friends and families can gather virtually. I want to thank those funeral home industry, the funeral homes, for continuing to innovate and making it a safe way for those to grieve. I want to be clear about nursing homes. My executive order limited visitors to nursing homes, but by no means did it limit the end-of-life visitations. So please do not limit loved ones from visiting their loved ones at the end of the life. Now I want to update you on where we are against the fight against COVID-19. We're seeing tremendous evidence right now that our social distancing, all of my executive orders are working. We are flattening the curve in Oklahoma. It is critical, though, that we don't take our foot off the gas. We need to continue these social distancing practices through the end of April so we can get back to normal as soon as possible. So remember, stay at home if you can, limit your trips to essential businesses, and limit one person to the grocery store if possible. On testing, we have currently tested in Oklahoma 22,000 individuals. We have more than 70 mobile test sites set up all across our state. One of our private labs here in Oklahoma, RML, will be doing their 5,000th test today. I'm just so thankful for all the testing that we've put together in a short amount of time in our state. COVID-19 has caused many challenges, but it's also created great partnerships. I really appreciate those partnerships with all of our private labs, both of our universities for really standing up their testing capacity. I want to remind Oklahomans that if you have symptoms of a temperature of 100.4, if you have shortness of breath or cough, or if you've been exposed to someone that's tested positive for COVID-19, I want you to get tested. Remember, you can call your primary care physician, you can call 211, or you can go to coronavirushealth.ok.gov to find out where you can get tested. We currently have 1,600 positive cases in our state, but 790 people have already recovered. I'm also cautiously optimistic regarding our trends in hospitalizations. We have remained flat for the last 11 days in our COVID patients hospitalized all across our state. That's a good trend that our modelers are continuing to update. But now is not the time to stop the social distancing. It is working, and we've got to continue that effort through April 30th. The IHME model that the White House Task Force references shows that Oklahoma is flattening our curve. I wanted to show this map to you. We are projected to see 1,115 beds needed. That's what the model shows. Even on the high end of the model, around 2,698 beds, the great news is Oklahoma has 4,633 hospital beds specifically designed for COVID patients in the state of Oklahoma. So we have created tremendous capacity. We're in good shape. The next graph shows 229 ICU beds needed. Oklahoma, we have 3 times that many ICU beds available in the state of Oklahoma. Even on the high end of the peak, we're still in good shape. When it comes to ventilators, our last graph I wanted to show you, we're projected to need 195 ventilators at our peak. But Oklahoma, we are very well prepared. Our team has been searching around the globe for more ventilators, and we have almost 1,800 total ventilators available in the state of Oklahoma, more than we're going to need even in the large end of the peak. Even with what the IHME model projects as the worst case scenario, I just want to remind Oklahomans, we are in good shape in the state of Oklahoma on total beds, ICU beds, and ventilators. Our state health department has also been working, and I've been asking the modelers at the University of Oklahoma and Oklahoma State University and the state health department with their epidemiologists to continue to revise the models from the data we're seeing on the ground in the state of Oklahoma. And I want to remind Oklahomans, that's the way that we will make decisions in our state, is based on the scientific data and the health experts that are advising us. The state model moves the peak up to April 21st, but shows we'll need fewer hospital beds, but more ICU beds, but still well under Oklahoma's current capacity. Either way, we're in good shape, and that's been my #1 goal, and the Governor's Solutions Task Force is to make sure that Oklahoma is prepared for any inevitable peak. But I want you to know that just because the models continue to look better over time, we have to keep our guard up. You know, in Oklahoma, we love our weather forecasts. And despite how many talented meteorologists we have across our state, we know that forecasts can change over time. And the hook echo doesn't always drop a tornado. That's why my Governor's Solution Task Force has been working so hard on this detailed, comprehensive plan to plan for the worst. I hope we never have to use it, but I want you to know that we will be prepared in the state of Oklahoma. Before I turn it over to others on my task force, I want to thank all of our wonderful hospitals, our doctors, our nurses, our healthcare professionals, our first responders around the state for everything that you've been doing. You know, most of our hospitals have had to make some really tough decisions, financial decisions, by foregoing elective surgeries to protect the PPE in case of this surge. So I want to thank the hospital specifically and what they're doing to get ready for this surge. They've done a tremendous job. We asked them to surge up to make sure that we had the capacity for Oklahomans, and they've done a really good job. And I wanted to bring up Patty Davis. She is president of the Oklahoma Hospital Association to give you an update and tell you some of the great things that our hospitals have been doing. Patty, will you please come forward?
Well, thank you, Governor Stitt, and thank you all for being here today. When we were tasked with determining whether or not Oklahoma was capable of tackling this crisis, the Oklahoma Hospital Association quickly inventoried our member hospitals to determine how many beds are available, how many ICUs are available, and how many ventilators are available. What we learned is an amazing thing about Oklahomans, that we are ready as we can be for what may be coming at us. We know after taking an inventory, not just Oklahoma City and Tulsa have the capability of taking care of COVID patients. Today, hospitals across the state are doing that, and they're doing it very, very well with their medical staffs and managing people close to home. The surge plan will rely upon a regional model. That being said, we have 72 hospitals that have ventilator capability, and that is by far the most critical need in the most serious patients. The surge plan will work like this. We will keep patients in the region to the capability of the region if all possible. If a higher level of care is needed in Oklahoma City and Tulsa, that will be managed by the TREC, which is the Trauma Triage Referral Center, and they will be managing transfers in. We want to be very clear that we believe all healthcare facilities will be playing a role in this surge, because even if a hospital is not ventilator capable, then we know that a hospital patient not needing a ventilator could go back to a lesser care site. In fact, you may say, why are we here today at OSU? Because after determining this regional concept, we know that our hospitals have the beds and have the capacity, but being in the abundance of caution, we're looking at what would happen if all the hospitals reached the capacity. So there'll be 2 facilities, 2 in the Tulsa area, 2 in the Oklahoma City area that will be considered should hospital capacity reach maximum peak. There will be 1 COVID, there will be 1 non-COVID. But make no mistake, every hospital with the capacity to take care of COVID will be. Oklahoma State University Medical Center will be that center in Tulsa, and the Oklahoma City site will be announced very soon. Our regions are based on the trauma regions. That's also our Homeland Security regions. We already have people in place working in those regions together regarding emergency medical personnel, hospitals, and doctors. So it makes sense to follow an already established region. Hospitals are already planning. As you know, hospitals have discontinued elective surgery to save PPE, as Governor Stitt laid out. But we also know that the surge is coming. So we are preserving our PPE for our workers when we know we are absolutely going to have it. So I'd like to say thank you to the folks that have helped us put this plan together with the National Guard, the Oklahoma State Health Department, and my team at OHA. And at this time, I'd like to turn this over to Dr. Mo Som, who's the Chief of Staff of OSU Medical Center. Dr. Som?
I wanted to, first of all, thank Patty and Governor Stitt as far as all of the efforts that they've actually taken to ensure that the city of Oklahoma is actually protected appropriately. I also want to emphasize what both of them have mentioned is that this very much is a collaborative effort between all of the healthcare facilities in conjunction with the governor's office. This has been designed very carefully in order to protect all of our Oklahoman citizens if this surge should actually happen. One thing that I do want to emphasize that was also mentioned is that this is not able to be accomplished unless all of the healthcare facilities are working together. This means that patients that are in their existing systems, if they're COVID positive, should not be transferred immediately over to COVID designated flex facilities. This is essentially a safety outlet if we should in fact hit the surge. One of the most important things that I can encourage all of Oklahomans to do is, number one, maintain social distancing, maintain good hand hygiene, because we know those things are actually working. In addition, if you have concerns or questions, make sure that you maintain a good relationship with your primary care providers, either through virtual medicine, telehealth, or just simple phone calls, because those individuals play such an important role now, so that we can keep our Oklahomans safe, we can keep them at home if at all possible, and we can keep them protected from the COVID-19 virus. And now I am going to introduce the Army National Guard, who is going to give you a little bit of a brief update, as their role is very, very important in this time.
Thank you, Dr. Som. I'm Lieutenant Colonel Murray. I'm currently a medical administrator and planner for the Oklahoma Army National Guard. And currently our role, at the request of the governor, is to have the 29 members of the Oklahoma National Guard Joint Task Force, which is commanded by Brigadier General Tommy Mancino, and we've activated them to join in with the governor's task force. The 29 members are made up of various soldiers and airmen with various skill levels. And our mission right now is basically we are contributing partners. We are contributing planners. We are assisting in the communications. We are assisting in data collection. And then very quickly, we are also going to support the locations for the strategic national stockpile that includes the PPE inventory as well as other equipment that is ready for distribution. We continue to look forward to supporting the Governor's Task Force, the people of Oklahoma, in this very important endeavor. We are definitely all in this together. It's a very sensitive time for us, and we understand that, and that is why I want to emphasize we are your neighbor. The motto of the National Guard, what we have right now, is always ready, always there, and that's exactly what we intend to do. Thank you. Governor?
Thank you, Lieutenant Colonel Murray. Dr. Somm, appreciate that. Patty, thank you for your comments. You know, I want Oklahomans to know that we are prepared for whatever may come. We have the hospital surge plans in place, and that's our main goal, is to make sure that ventilators, ICU beds, and hospital beds, that we are prepared for any spike that might happen. I also want our healthcare community to know that we will be holding online information training sessions about this surge plan over the Echo platform. So please be watching looking at your email, and we'll be sending you that out so you can dial in if you have questions. Oklahoma, we all have a job to do right now. We can all play a role in making sure that we remain safe. So stay home if you can. Be responsible about your trips to the store by only sending one person, and make sure you continue to practice all the social distancing that we've laid out. You know, we are going to get through this together, so stay home, stay safe, and stay strong. So God bless you. Have a great weekend, and we'll be back in here to update you again next week. Let me open it up to a few questions for myself and the team. Yes, sir.
We've gotten some questions about whether there are people who have died with COVID-type symptoms, but they weren't tested while they were living, and whether they are tested after they post-mortem. Yeah.
I'll let, yeah.
Great question in regards to if individuals are actually dying with potentially COVID-type illnesses, but they may not have been tested. We can't count for all of the individuals that are in the community that may have actually died within the community and they actually hadn't reached a healthcare facility to be tested. As far as the post-mortem diagnosis, it really depends on if those individuals are going for autopsy or not, if you can actually truly determine if their death was related to a COVID-related illness. One of the things that I think the public needs to understand and keep in mind that we still have other underlying conditions that can play a role in the risk of having an illness that could potentially be fatal, and not every death that is transpiring is 100% related to COVID-related illness. And so the other part of your question was, are patients being aggressively screened essentially as they're coming into the hospital for any possibility that it could be related to COVID? I can assure you that that is happening. We understand that this virus is continuously changing, and we understand that this virus is potentially presenting with other concomitant disease presentations. And so those individuals are being screened appropriately, and definitely not unnecessarily, to ensure that if COVID is playing a role into their health care, that is being addressed.
So, but I suppose if someone were to die at home or something like that, it's possible
That they could have potentially.
And they're not, there's no autopsy, so we don't really know what happened.
No, if an individual has died at home and there was no autopsy, there was no way to definitively tell, well, if that was a death secondary to a COVID-related illness.
So I guess the answer is it's possible, but not likely.
You're correct. It is always possible. Yes.
Well, you're so you guys had said at one point, once OSU Med got up and running the testing lab center, you would be able to test anywhere from 2,000 to 2,800 people a day. The most up-to-date numbers are showing that you've done basically 2,200 in about 2 weeks. So what's really going on with that, and when will we see that,
That increase in the numbers?
2,800? Yes.
Sure. Good afternoon. I'm Jerome Lothridge, Secretary of Health. The OSU facility is ramping. They have capacity currently to do as many as up to 2,800 tests. Right now, for instance, yesterday we collected 1,000 samples, 1,000 swab samples through our distributed testing and sampling centers. So it can, at full peak, reach that. It's really, at this point, a matter of getting our sampling numbers up. One of the key limiters in that is our swabs. We believe we have increased the number of available swabs for so doing. But when the center is up, when the testing center is up to its full capacity, which could be in a matter of days, then we can process that many. But at this point, it's a matter of collection and the pace at which we're able to collect.
So you're saying it's still not up to full capacity right now?
Oh, it has the full capacity to do so. Now it's a matter of sampling, of getting the samples in on the front end.
So you're saying you're not getting the 2,000, 2,800 samples?
Right. No, we collected 1,000 through our system as of yesterday. So that's the governor's admonition that those individuals who are presenting symptoms be tested. This is the way in which we will increase that total base of testing.
I have a question for the governor. So you're urging people that are feeling symptoms to get tested. But we've gotten a lot of questions about folks who aren't able to get tested. There's some stipulations and criteria that vary from county, lab, mobile testing sites. So what do we tell Oklahomans who still can't get tested right now?
I've heard the stories as well, and I've get some texts or questions or emails or just people that come up and say, hey, we've tried to get tested and we can't get tested as well. Our message is call 211. That's why I've set up 70 mobile testing facilities around the state. That's been our message. We want more testing done. So I want them to call our office, and we're continuing to send out memos to all the different health departments around the state. We have plenty of testing in the state to handle it. And back to that earlier question, we can test through one lab 2,800 a day, but we only got 1,000 test samples, and those are spread out between the multiple labs. But you should get tested if you have symptoms or if you've been in contact with someone that tested positive for COVID-19. So call the 211 and make sure they'll direct you to where you can go get tested.
I have a question for you on testing. Okay, so we saw the big jump that you guys put out in the negative numbers, saying you were waiting, for all those private labs to report to you. We've been in contact with some private labs who are saying they're reporting those numbers daily. So why are we not seeing that come in as far as our knowledge?
Well, I think we are seeing it. We have 22,000 tests now, so I think we rank right in the middle of the pack of the other states per population of the number of tests that we've run. So we just had in the very beginning, the private labs were only sending us the positives, so we had to chase that down and get the reporting mechanism going. It was an effort for our team, and we did that. I think last week we got that posted. Now we're up to 22,000 tests, and we're going to continue to do that. The other positive thing is we think we're going to be a national leader on an antibody test. We have some labs right now proofing some antibody testing. That is going to be a game changer for Oklahoma and the nation when we can test the general population of who's been exposed and who has already developed antibodies. So out of the 1,600 people that are positive in Oklahoma, remember 790 have already fully recovered. And so we need that information out there as well to get everybody back to work. And so we're working on that. We need more data, of course, but those are going to be some things that will help us get back past this and get this in the rearview mirror.
Along those same lines, you had said you had to go get that data from the private labs. So those backdated negative tests, you said went back to early February. We didn't have a positive test until like a month later. So my next question is, can you tell me how many people were tested in that month? And I guess they were all negative? Did we,
Well, I never said the month of February, so I'm not sure when that went back, when the first test was. I know we had our first hospitalization in early March.
Right.
So I would have to dig into the details on those 22,000 and find out when the first test was from a private lab. So You realize that the hospitals around the state have certain contracts with private labs, and that private lab could be in California or Dallas. That's why I focus so hard to get our labs in the state to turn those over within 24 hours, because it was taking, in some cases, up to 7 days to get a positive result. I just have to go back and look at the details on the 22,000 to find out when the first negative popped up.
Yeah, I think that would be interesting.
Sure, we
With
can.
With all the talk about when this actually showed up in Oklahoma, I know we never know, but I think it would be interesting to know when we started testing actually and how many negative tests.
Yeah, I'll be happy to get you that detail on that 22,000, and we get a briefing every single day. I've got briefings that have all those tests. I know how many swabs we're doing. We're ramping that up tremendously, because that's about isolation and really tracing down and who has come in contact with those people. It's just so important to get our testing up, and so that's why every press conference I'm reminding Oklahomans, go get tested if you have symptoms.
Thank you.
Thank you.
I'm sorry, I'm still not real clear on the not backup plan, but what the National Guard and the hospital associations do as far as the flex sites. Yeah, so the COVID flex, those are hospitals, or what are those that are being sort of like held in reserve in case you need them?
Sure, thank you. The model that we pursued, again, in close collaboration with the Hospital Association and with regional hospitals, really has these three concentric circles. In the center is the 40% flex-up plan. So you will recall that by virtue of the governor's executive order about 10 days ago, hospitals were asked to submit plans that contemplated a 40% flex-up. So the center circle represents the collaborative effort of all the 151 member hospitals and all medical centers in the state. So in the yellow is the 40% flex-up that was brought in from that. In the next concentric circle out, we stipulate that there will be 2 COVID flex hospitals, one in the greater Oklahoma City area and one in the greater Tulsa area. We're sitting in the greater Tulsa area's location here at Oklahoma State. Go ahead.
Is it here or is it the hospital over here?
Yeah, it's across the river, so
Okay.
right over here.
Be
Yeah,
clear.
we're sitting proximate to the location, but here at Oklahoma State University. The outer concentric circle is really designed for true flex capacity for non-COVID. So it's possible that we displace sufficient numbers of patients such that we need other hospital capacity. And in this respect, we've drawn in the U.S. Army Corps of Engineers. They've reviewed a number of sites. Again, this was pursuant to the governor's executive order and his particular stipulation that the Corps go and look at a minimum of 10 locations. I believe they've actually surveyed a much greater number of that, 15 to 20. These locations are diffuse and are throughout the state. They will represent what we will go to, again, if we need non-COVID folk accommodated in other hospital settings. And that planning is underway. Those are projects that can be turned on fairly quickly in the matter of days through the U.S. Army Corps of Engineers. And then taken together, again, important to remember that the outer 2 rungs really do represent our safety net should we see an overrun in that 40% flex up over our existing hospitals.
Okay, and so then I've also read some stories about hospitals that have said that some of their shipments and equipment have been seized by the federal government. Have we had any of that here, or is there any concern that since we seem to be sitting in a pretty good shape that somebody's going to come in and say, okay, we want 100 extra ventilators or something?
Right. We have not particularly experienced seizures by the federal government. To be clear, there are abundant supply chain disruptions. Most of this equipment, as you know by now, is coming out of China, and therefore the supply chain is always suspect, but no time greater than this pandemic. Nonetheless, our particular circumstances are that we sit in good numbers on those key areas, masks most particularly, N and KN95 ventilators, or respirators rather, and then on other nitrile gloves, gowns, face shields. Many of those items are either in full stock or are actually being produced here in Oklahoma. I would cite both gowns and face shields in that latter category.
Governor, how quickly quickly, per your understanding, how quickly can people go get a test and get a result? What we hear is that people, even with symptoms, are being turned away, and then when they're tested, it's a week to get the result back. So what's your understanding about what's supposed to be happening? Why is there a gap between what we hear and what you say should be happening?
Well, if you're hearing that people are being turned away for testing if they have positive, I want to know the specifics so I can call that hospital or that testing. Remember, Oklahomans, call 211. They're going to send you to a mobile site. We have 70 sites set up across the state, almost in every county. So we want to make sure it's accessible for Oklahomans. If we're not testing Oklahomans, I want to know specifics so we can get a hold of those hospitals. I can't be any more clear. We have the testing in the state. If you have symptoms or if you've been in contact with someone with COVID-19 that's tested positive, we want you to get tested. So I can't be any more clear about that. We have the testing. We should be able to get those tests back within 24 hours. Our labs are running within 5 hours. So if we get it in that day, we're probably going to get you the results the very next day. Well, thank you so much for being in here, and thank you, Oklahoma. We are going to get through this.